This is Counterpoint, and I'm your host, Tanya Granick-Allen. The leak of the World Professional Association for Transgender Health Files, or the WPATH leak as it has been called, has created a stir within both the medical and transgender communities. WPATH declares itself an interdisciplinary, professional, and educational organization devoted to transgender health, end quote. The leaked documents, which were not meant for public dissemination, contained internal discussion about guidelines, treatment protocols, and recommendations concerning the controversial gender-affirming care code for treatments for individuals aimed at so-called transitioning genders. The organization which published the leak files, Environmental Progress, claims that the documents reveal, and I quote, widespread medical malpractice on children and vulnerable adults. Perhaps most controversially, the WPATH files expose internal discussion and debate of the challenges of gaining informed consent for medical treatments from children, as well as from people with mental health disorders. Shocking to say the least. The leak has raised concerns about the integrity of medical organizations, the activism, and the standards of the professionals who are engaged in gender-affirming therapy. Are these professionals actually invested in the long-term well-being of patients? Or is this leak reflective of an ideological push towards a more politically driven medical agenda? Can a child or a mentally ill person actually provide true consent? As the debate wages on, I'm pleased to welcome Mia Hughes, an Ottawa-based journalist and researcher for Michael Schellenberger's nonprofit Environmental Progress, who again exposed the WPATH files scandal to the world. Mia, thank you so much for joining me. I appreciate your time today.
Thank you for having me.
So before we dive right in, how did you get involved in researching this issue? Were you always skeptical or always on board with this issue?
I would say before 2019, I was largely unaware of the issue. I leaned to the left politically. I was a stay-at-home mother. I was homeschooling my kids, and I wasn't very political. And then around 2019, I discovered that something wasn't quite right. You know, this whole trans women are women and all of the pleasant sounding slogans. When I looked more closely at them, I realized that something was amiss. I realized that we were supposed to believe trans women were actually women, which made no sense to me whatsoever. Some of them were calling themselves lesbians. But the real pivotal moment in my life was when I discovered what was happening to adolescents in pediatric gender clinics in Canada and across the industrialized world. I learned that these adolescents were being chemically castrated using experimental drugs called puberty blockers. They were having healthy body parts amputated, all because of a self-declared transgender identity. And so from the moment that I discovered that was happening, I became completely obsessed with figuring out why. And to cut a long story short, I ended up working for Michael Schellenberger, writing about gender. And that's when we got the WPATH files, and I got to write the report about them.
Okay, and before we dissect some of these files, when you said you were largely unaware of what was happening specifically with, well, I guess gender-affirming care, as it is known euphemistically, do you think that represents the majority of the population, that most people are actually unaware? And you use the frame chemical castration. What do you mean specifically by that?
I certainly think that the vast majority of people are unaware. In Canada, still to this day, I would say that that's true. And that is because our mainstream media, their behavior has been shameful on this, and they have absolutely not had the courage to deal with this issue at all. As for chemical castration, so puberty blockers, they shut down the endocrine system. They prevent the young person from going through puberty. The actual chemical castration comes when they give the young people cross-sex hormones straight after the puberty blockers. So the child never goes through puberty and therefore never develops, the reproductive organs never develop, so therefore they will never be able to have children.
My goodness. And we only have about 20 seconds for a commercial. This happens in Canada? It's rampant?
Oh, very much so. I think Canadians, the average Canadian probably thinks this is an American issue. We don't have this problem here. But this is going on in our gender clinics all over Canada, our main gender clinics and little private ones. It's happening from coast to coast.
Okay, Mia will be right back after this commercial.